Are you constantly feeling anxious in social situations? Could this be due to social anxiety disorder? This condition affects about 15 million people in the United States. Now, this is more than the entire population of Pennsylvania and more than the population of countries like Greece and Portugal. Hi, my name is Dr. Air. I'm a board-certified lifestyle psychiatrist. Social anxiety disorder is one of the most common anxiety disorders and usually begins in early adolescence. Also known as social phobia, many people struggle with the symptoms for years before seeking help. In fact, many people do not realize they are struggling with a mental health disorder. They may think they're shy or introverted. Social anxiety disorder can be exhausting and cause you to feel lonely. It can make you sacrifice your freedom and independence, affect your relationships, and hinder you at work or school. Simple, everyday tasks like going to the grocery store or running errands can feel like enormous challenges. There is also fear of judgment, meaning you may go for years without treatment. So let's talk about 10 signs that indicate you may have social anxiety disorder. Number one, you have a lot of fear about one or more social situations where you're exposed to possible scrutiny by others. Examples are social interactions such as conversations or meetings with unfamiliar people. Situations where you're being observed, such as eating or drinking, may also cause a lot of anxiety. Another example is performing in front of others, such as giving a presentation. Number two, you fear that you will act in a way or show anxiety symptoms that will be looked at negatively. This means you worry about being humiliated, embarrassed, rejected, or offending others. Number three, certain social situations provoke a lot of fear or anxiety. Examples will be fear of attending networking events or having everyone sing happy birthday to you in a group setting. Number four, you avoid such social situations, but if you must attend, you endure them with intense fear or anxiety. Examples include skipping a friend's party, staying silent in meetings, sitting on the back row at events to avoid being noticed, but feeling highly anxious when others approach. Number five, your fear or anxiety is out of proportion to the threat from the social situation. For example, you may have intense anxiety having small talk with a stranger as you worry you may say something wrong. Another example is avoiding eating in public because you fear people will judge how you eat, even though most people are preoccupied with their own meals. Number six, your fear, anxiety, or avoidance is persistent and lasts for 6 months or longer. An example is someone who has constantly turned down invitations to social events for the past year due to the fear of judgment or awkwardness. Another example is avoiding group sports or fitness classes for over a year, fearing embarrassment in front of others. Number seven, your fear, anxiety, or avoidance causes severe distress in your social life at work or other important aspects of your life. So avoiding important work presentations due to anxiety may lead to missed promotions or professional growth opportunities. Also, your fear of social interactions may make it hard to date, resulting in isolation and loneliness. Number eight, your fear, anxiety, or avoidance is not due to medications, illicit drugs, or medical illness. For example, you consistently avoid social gatherings out of fear of judgment, but this is not due to underlying health issues or drug use. Number nine, the fear, anxiety, or avoidance is not due to another mental disorder. Some psychiatric conditions like panic disorder, autism, and body dysmorphic disorder can cause fear, anxiety, and avoidance. And lastly, number 10. If another medical condition is present, the fear, anxiety, or avoidance is unrelated or is excessive. Conditions like Parkinson's disease, disfigurement from burns and injury, or obesity can present like social anxiety disorder. Treatment of social anxiety is crucial. There are effective strategies to manage your fears and anxiety. Cognitive behavioral therapy, CBT, is the most effective psychotherapy for treating social anxiety disorder. It helps you identify and challenge the negative thought patterns that make you anxious in social situations. CBT also involves gradually exposing you to the social situations you fear, starting with less intimidating scenarios and slowly building up to more challenging ones. This process, called exposure therapy, helps reduce avoidance of the social situations you fear. Medications can be an essential part of treating social anxiety disorder, especially when your symptoms are severe. Effective drugs for treating social phobia are selective serotonin reuptake inhibitors, SSRIs, serotonin norepinephrine reuptake inhibitors, benzodiazepines, beta blockers, and buspirone. Watch this next video where I talk about 5 different ways to overcome your social anxiety.